Welcome to Biztech's Health and Wellness Show, where we focus on equipping you with the knowledge on health and wellness to help to ensure a more productive and healthy life for yourselves, your families, and your employees. Today's conversation is about mental health. To bring insights, we have Joan, the founder and CEO of Thoughtfull, a digital mental health support app in Malaysia, Singapore, and the rest of Asia that provides affordable, approachable, and accessible mental health. Now, welcome to the show, Joan.
Thank you so much, Brian, for having me here.
Now,
Pleasure.
now, Joan, give us an overview of Thoughtfull and what inspired you to start it.
Sure, no problem. Well, hi everyone. Thank you so much for having me. A quick introduction. My name is Joan Low, and I'm the founder and CEO of Thoughtfull. We're a digital mental health company whose vision is really to make access to mental health care more seamless and affordable for people. We mostly work with organizations, so employers, universities, and the like, to really bring mental health care end to end to the end user. I guess one of the biggest motivating factors for the founding of Thoughtfull was something that came from a very personal place, to be honest. Because as you know, Brian, I mentioned really quickly, I had a very different life before this. I was actually a banker working in Hong Kong at JP Morgan for 6 years, where I was managing a portfolio of about 1.3 billion US dollars. The reason for taking this huge leap of faith was coming from a place of frustration with the pain points of the mental health care system. Okay. So we have been mental health caregivers to a loved one for the last 20 years or more. And as you can imagine, in the 90s up until today, unfortunately, not much has changed, or at least at the pace at which it could. And I think, seeing that huge digital innovation between what could be and what's happening right now in places like the US, for example, where I spent, many years there, versus what is happening here in Asia, was a huge gap. And it was really that frustration of seeing that that motivated me to leave finance altogether and start Thoughtfull. As you know, it's a very fragmented market. It's a very nascent market when it comes to digital healthcare. And so we're very happy to be one of the pioneers to really bring this to the next level.
Okay, break it down for us, Joan. What are the specific challenges that you're trying to solve with Thoughtfull?
So I think maybe we can talk about it from a very simple perspective in terms of, breaking it down to economics, right? Supply side, demand side. Okay. I think that's something that we can probably all understand. The demand is increasing. And I think this was always the case where demand for or the need for mental health care was always there even before the pandemic. But I think what we're seeing on the demand side is that with the pandemic, it has really accelerated demand at a pace that we've never seen before. Of course, stigma is still going to be a challenge here in Asia, where it's not a normalized conversation yet. But I would say that it's significantly reduced compared to before the pandemic because awareness is just higher. So we have high demand on one side. On the other side of the equation, we have a supply chain that is very fragmented. Really, the infrastructure is not quite ready to bring that kind of seamless care delivery to the demand that we have. The reason for this is because majority of mental health professionals and mental health care delivery is actually done outside of the medical system. Now, what do I mean by that, right? So out of all the mental health professionals, you have your counselors, your psychologists, and your psychiatrists. Only the psychiatrists actually sit within the hospital or medical settings because they're qualified doctors, with access to, the electronic medical records and all of that. The majority of care delivery in the mental health space are actually done by professionals sitting outside of that system. Counselors and psychologists who are allied health workers. Most of them either run their own private practice. Some of them are, micro entrepreneurs on their own, running their own business, which means that number one, a lot of it is not digitized. Number two, it's not standardized. And number three, it's very hard to figure out who is credible, who is legitimate, and who's the right fit for me as an end user. So in terms of the supply side, there is some infrastructure building that needs to be done. That's what we're doing with Thoughtful Chat Pro, which is our one-stop platform for mental health professionals. Okay. And in actually building the piping and the infrastructure for that, digitizing and standardizing care delivery, that's how we bring seamless and affordable mental health care at scale to the high demand of users that we see now.
Okay, Joan, I'm going to get back to you on how Thoughtfull works in detail. But before
Sure.
that, as you mentioned earlier in the interview, that, we've had a huge impact on mental health because of the lockdowns. Do you have empirical evidence that you can share with us from your users, both individual and corporates, in terms of really the challenges that are there?
Absolutely. And I do have to say that, as in Malaysia here, we're going through a tough time. I would say the fact that the lockdowns have been never ending, yet cases are always increasing. That has significant impact on someone's mental and emotional state. So just to anecdotally share, on an aggregate basis, when the I guess MCO 3.0 was announced and then followed by EMCO, just within our user base, we saw a spike of 60% increase week on week of critical cases. And when we say critical cases, we're talking about cases that either need to be escalated or monitored very closely for suicidal ideation and things like that. That was actually what drove one of our community initiatives, which we launched for the month of July, to really bring access ASAP to people, where we actually opened up the lines and offered, free therapy for people who needed it, because that was how bad we were seeing the numbers, even within our own user base.
Okay. Now, traditionally, what kind of individuals really go out and seek therapy? Traditional therapy.
Traditional. I like how you use the word traditional therapy. I appreciate the distinction. So for people who are wondering what that means, so traditional therapy is really, think about it as your 60-minute conversation with a qualified counselor or psychologist, what we call psychotherapy or counseling sessions. The non-traditional, or rather, I guess, digital therapy would be anywhere in the form of either doing it, through text and audio message, or sometimes it's even with a bot, right? So that's more on the digital, more modern side of things. Now, in terms of traditional therapy, who actually shows up? By nature of it, because it's more on the curative spectrum, most of the time it's for people who are looking for some crisis intervention. That's just the nature of how it is in Asia. Preventive engagement with mental health is not yet commonplace. So therefore, for mental health, most of the time it's because they're going through a breakdown, they're really stressed, having panic attacks, or very depressed. They have no other choice. That's why they go for therapy. That has since changed, I would say, with the pandemic, but also with the new generation that we see.
Okay, so this is where digital therapy then comes in. So describe to us then how Thoughtfull works, because it starts really with really a one-to-one engagement via an app daily.
Yes. So a little bit different from the traditional models. So I think maybe to really level set here, the aspect of mental health care that we're targeting towards is really on preventive engagement for mental health, as well as really thinking about engagement of mental health as more of a lifestyle choice rather than waiting for it to be a crisis intervention. There's a very large difference here. Similar to how we are exercising preventatively, it's the same thing for our minds. So how Thoughtfull Chat actually works is very simple. You sign up and essentially you have full access to, curated in-house lessons and self-driven tools that you can either do it on your own or with a coach. If you'd like to work with a coach, and again, all our coaches are qualified counselors and psychologists. If you do want to work with a coach, our algorithms will instantly match you to your best fit coach. So it takes away the guesswork, right, of who I should go to and is that the right person for me. And you can text an audio message anytime, anywhere, and our coaches will check in with you asynchronously within 24 hours. So gone are the days where you have to wait for 3 weeks before your appointment with your counselor. You can literally text an audio message on a thought, on an experience in real time, and capture that. And then you can, have that conversation and journey with your coach throughout the entire time.
Joan, as a business, you have a consumer as well as a corporate focus. Break down the differences in terms of how you cater for them and the business model around it.
Yeah. So in general, our business is actually more focused on B2B2C. So I would say a majority of our business is from the corporate side of things. So when I say corporate side of things, I mean by employers who are seeking for mental health care solutions for their employees so that their employees can access that for free. So that actually is the bulk of our business, and we work very closely with corporates for that. In terms of the consumer side of things, this one, anyone on the street, it could be you, it could be me, it could be anyone. You can download our app both on Apple or Android, and you can sign up for a monthly subscription.
And can I ask you, in terms of the corporates, obviously corporates have recognized that their employees are really going through a tough time in terms of remote working and things like that. Mm-hmm. Where have you seen the biggest adoption in terms of your customer base?
Mm-hmm. So when you say biggest adoption in terms of the end user employees or the actual corporate industry?
Well, actually both. And we can go from both sides, because is it from an industry perspective and also the type of employees, the age group, the demographics and stuff like that. Share with us some anecdotal insights into that.
Sure, not a problem. So I think I can speak from a point of experience in the last couple of years as well, right? Because Thoughtfull has been working with corporate since 2018, even before we launched an app. And so I think what is one of the biggest differences we're seeing in the corporate segment is the fact that before, a lot of focus was more on mental health awareness rather than taking action and giving actionable tools that their employees can use. The main difference in the conversation of focus today is actually on action rather than just awareness. Gone are the days where people are doing, ad hoc kind of programs. They're really looking for sustainable, programs that run for a long-term basis for their employees so that they can take action. In terms of the industry, I would say that it's across the board. I don't mean to be, exaggerating this in any way, but whether it is the MNCs or the local companies, people who already have had EAP programs, employee assistance programs, or people who are doing it for the first time, we are seeing demand across all segments. Back then, before the pandemic, it was mostly from MNCs. So this is a big difference. In terms of the end user, so, employees who are actually using Thoughtfull Chat, by and far, most of the people that we do have in our user base are between 25 to 45 years old. So I think it's very intuitive, right? Because this is the digitally savvy generation. This is also the generation that is a bit more open to discussing health and well-being. And I think it's also the generation where they're putting health and well-being investment in a very high priority in terms of how they spend and allocate their expenses. So this is something that we're seeing on the ground here.
Okay, as an individual, Joan, a lot of us now are surrounded with people who are really struggling to cope with the lockdowns and the pandemic. Yeah. How can we help them?
Yeah, great question, Brian. I'm so glad you're asking, because I think each and every one of us can play a part. Absolutely. I think in terms of how we do help, this is a broad range, but I would say first and foremost, be there to listen without judgment. Regardless of what is happening, it could be a full-blown meltdown, or it could be someone who's just going through a really tough time and bringing a lot of, sharing a lot of their struggles with you. Whatever it is, listening without judgment is the first step in opening up that conversation and building that trust so that they will continue to open up to us. So that's step one. In terms of step two, I think it's actually incumbent upon all of us to actually know a little bit about psychological first aid. So, back then it was in school or even in offices, they would teach us how to do the physical first aid, right? How to do CPR and things like that. There is such a thing called psychological first aid. So this is for your mind. And I think the most important for us is to equip ourselves with the education and knowledge on how to do the 3 L's of psychological first aid. So how to look out for the signs. So knowing the signs and symptoms to look out for, how to listen for it as well. It could be what people are saying, how they're expressing their thoughts and what have you, and how to link them to the right resources. Now, not all of us are qualified to be that counselor, right? There is a very fine line between being that trusted friend who's supportive versus trying to be that counselor. I think that's probably when we need to know where the lines are and then linking them up to the right resources. So the 3 L's: look, listen, and link.
And Joan, next question is, if we are an individual and we are struggling, how can we help ourselves and when should we seek help?
So I would say, and I would put it in a very anecdotal, what do you call it, angle, right? If let's say, for example, it was a physical ailment, if we were having a fever or having a cough, we would not wait for 3 days, if not 1 week, to go and speak to someone about it or express that, right? We don't do that for our physical bodies. It's the same thing for our minds. If we are going through stress, severe anxiety, which is completely normal in this current circumstance, do not wait to express this. Do not wait to engage with it and go delve into further support. There are multiple things that we can do. I think sometimes people think, oh, I have to do all the big things at once for big changes. In fact, it's all about the small changes that we do every day that will help us to, get to the big change. So I would say that, feel free to explore Thoughtful Chat. There's a whole bunch of resources on the app where you can start learning about it. If you're not ready to talk to someone, that's completely fine. But most important is to equip ourselves with the knowledge so that we understand ourselves better. What we also do have on Thoughtful Chat is actually an assessment for measuring our levels of stress, anxiety, and depression. Now think about it as a weighing scale for our mind, right? We know how much we weigh, we know how tall we are. Most of the time, we don't know where our levels are for stress, anxiety, depression. Get a check for that, see where we're at, and then that kind of awareness will lead us to then know how to take further action from there. Any questions, of course, feel free to reach out to us on our website or anywhere, and we have a ton of resources to share.
Joan, it's been a fascinating conversation. I want to ask you, any final thoughts you want to leave the audience with before we conclude this conversation?
So in terms of the final thoughts, I think many thoughts that are running through my head now, but I think the most important one is to really share with everyone that mental health is just as important as your physical health. I think there's a very strong and extreme focus on health and safety physically right now. Do not neglect the mind as well. I think what we've gone through as a collective is probably the longest traumatic experience that humanity has gone through since probably the influenza. And so this is something that we should not ignore. We should not, sweep it under the rug under the pretense of, oh, we must be resilient and power through. No, it is a traumatic experience. This is not a normal experience and environment. It is okay to talk about it openly. It is okay to engage with additional support. And it's okay to engage with lifestyle changes that will enable us to nurture both our bodies and our minds together. If any employer wants to, of course, explore what this might mean for their employees, feel free to reach out to us at thoughtfull.world, thoughtful with 2 L's, obviously. Or if any individual wants to explore as well, of course, our social media and all of that is always available. Our Instagram at A Thoughtful World is very active for our consumer segment.
Now, thank you very much, Joan, for taking your time to be on the show.
Of course. Thank you so much, Brian. It was a wonderful conversation and a wonderful, thoughtful chat.
Yeah. I'm Brian Fernandez, and I've been speaking to Joan Low, the founder and CEO of Thoughtfull, on Biztech's Health and Wellness Show. This video will be on our Facebook and LinkedIn sites, as well as our website, www.biztech.asia. Please subscribe and like our various platforms. Thanks a lot for tuning in.